Rekha Gupta, consultant in Apollo Cradle in Indrapuram. I am going to talk about second trimester of pregnancy, in which your baby is already formed, and in 4.5 months you go for an ultrasound, and ultrasound you see all the congenital anomalies in the baby, and otherwise the vomiting part is settled, the baby started growing, there are babies, you can see the little bit of movement, especially after 5 months of pregnancy. You feel more energetic, more relaxed, and you can roam around, you can have better food to eat, and there are a few feelings of touch which you can feel at about 5 months of pregnancy. And this is the time when the brain develops and you respond to, there are a lot of movements, and you feel better and you enjoy this pregnancy part, especially till 7 months of pregnancy, and you feel better, your skin glows more, and there is a sort of a baby bump developing in which you can see the movements of the baby. Some symptoms which might come up is like normal pigmentation which comes up, and there is few incidences of backache. So usually we suggest that you take exercises and you start exercising, especially for backache, and some exercises for pelvis. Your teacher is going to direct you, maybe you can take few classes. There is another problem of stretch marks, but usually we don't recommend any treatment, especially during pregnancy. It is usually suggested after for these marks. There may be sometimes, because of the iron you are taking, sometimes there may be constipation, but newer drugs which have less constipation are recommended by the doctor. And if there is, sometimes there is nose bleeding, so just lie down on the back and pinch your nose and the bleeding might stop. Sometimes there is, especially when there is extreme cold. For diet, again, we are always recommending frequent short meals. Eat small meals at a time, and eat lots of fiber. Fruits are good, and you can have a little bit of maybe almonds and kishmish. That helps your constipation also. And usually diet should be short, and you should have plenty of water. This is always recommended, and short meals, and eat frequent short meals. And ideally it is recommended not to have Coca-Cola and all these things. Better it is for you to have fresh food and fresh drinks. I mean, you can have maybe quinoa juice or something in the morning, maybe just get it made in the house and you can have that. And lot of recommended proteins, fish, egg and fluids are recommended. You should visit a doctor every month for say 7 months, and after that maybe fortnightly checkups. And this is the time when you have to take vaccinations. So tetanus injection is given first, and then after 1 month tetanus and diphtheria and pertussis, Tdap is given, Boostrix, and third is for swine flu. So 3 vaccines are important in this trimester. And I wish you all well, and thank you.